I'm Dr. Clarke, Dr. Terry Clarke. We have a clinic out in the country outside of Sherwood Park, and the property's name is called Casa de Luz, meaning the House of Light. We do a lot of things here beside dentistry, but the focus of our point here today is to speak on the dentistry. We're finding that we are becoming overwhelmed with the amount of patients seeking services from us along the lines that we're offering. It seems like we have touched a nerve with society today, and we're finding people are looking for very high quality service, but with a different touch to it, a different approach perhaps. What we're finding is that people are looking for, and we are offering, a type of dentistry that gives to the patient a high level of education based on their particular films, meaning x-ray films, and photography. We spend a lot of time empowering the patient to themselves from the oral environment and also for the whole body by presenting them with as much information as we can from a dental perspective according to their needs, their health, and also incorporating their wishes and desires. We find a lot of people today, a lot of patients in particular, come here highly educated with taking advantage of the information that's available online, with the internet and other avenues of information, and are coming to us with this information, looking for a practitioner that can perhaps meet their needs and their goals in life. And therefore, what we offer becomes a symbiotic relationship. What we try to do here in this practice at Casa de Luz is offer what we call the cleanest dentistry that we can in the year 2008. And by that I mean we go through the materials and the procedures and everything that's available to the dental profession in the year, again, 2008, and try to select those that have the least side effects, the least toxicity, and yet give us the full spectrum of service for the patient. For example, we're finding that we're able to perform with the modern materials available to us today, probably over 50% of our patients without the use of anesthesia. And of course the question becomes why? Why work without anesthesia? Well, there's two very good reasons. The first one would be if we don't have to inject a chemical into the body to achieve the level of anesthesia that's usually required, then the body then doesn't have to filter out through the liver, the kidneys, and the lymphatics and everything else, the chemical that we put in. The other reason would be that if we're working on the positive side of the pain threshold on a tooth and able to achieve the complete result, we know we haven't pushed the tooth beyond its physical limit. Therefore, we know we haven't insulted the tooth, its nerve complexes, and everything else that goes with it. This technique is achievable today because of the bonding materials that we're able to use and the techniques that we have developed over the years of doing dentistry. So these are the type of approaches and these are the type of things that we're looking for here to present to patients so that we can come together and achieve a result that they're very happy and comfortable with. We look at different types of veneer materials that are available today on the market, for example. And we have selected a particular veneer that is able to be made as thin as a contact lens and requires usually no freezing whatsoever. And instead of having to reduce the tooth down to allow for the thickness of porcelain for strength, this particular product will allow us to provide veneers without tooth reduction. So we've accomplished a number of positives in this event. Again, no chemical injections, no tooth reduction to speak of, and we get very strong results. In terms of equipment that we're using in the practice, we're finding a lot of patients are coming for removal of amalgam fillings. And for that procedure, we protect ourselves and the patient from the potential of inhaling the vapors coming off of an amalgam filling with the mercury content. So we use oxygen for the patient. The patient will breathe oxygen through the whole procedure when there is metal coming out of the mouth. And we have a special filtration system that goes up against the patient's face so that whatever we aren't catching from the high and low volume suctions on the outside of the rubber dam is being collected, and the room is being filtered, and the patient is breathing clean oxygen at the time that the procedure is proceeding. So again, we take these extra steps, we take the extra time to give the service to the patient of a high quality and a high caliber. We use sapphire light systems here because the lighting system is so intense that we know we're curing our materials to the most highly the highest level possible. We have lasers for doing laser dentistry on the practice. We're using the Odyssey diode laser, and we'll be able to do everything from desensitizing to sterilizing and up to doing soft tissue surgery. We use it on a regular basis every day, and I'm very satisfied with the results that we get from that product. As you can see, we're using digital x-rays and intraoral cameras. This is one of the biggest boons to dentistry, I would think, probably in the last 20 years. And it allows the dentist the ability to share directly with the patient information on their situation in a format that makes complete sense to the patient. In other words, we can show, blow up, enhance, and delve into a situation. And I'm finding that patients are much more at ease once they have an explanation for something that's bothering them. And this is important. We're finding that the extra time that we're spending with patients to give them the information that satisfies not only their needs, but their curiosities as to what they're experiencing, gives them a tremendous feeling of self control and self-awareness, and a reduction in the fear and anxiety that most patients come to us with. So in terms of dentistry, we are offering the standard care of dentistry. We're not doing something highly outlandish. We're not wingnuts out in the wings of dentistry. We're offering standard care of dentistry, but we're looking at it from a philosophical approach that perhaps is a little bit different, by empowering the patient, by spending the time to give education, to give information, and to impart as much as we can to them, and then together come to a diagnosis that makes sense to them, and they have a big part in playing a role in their own health and well-being. And then we offer, as I said, the quote, cleanest dentistry we can in the year 2008.